Hi everyone, welcome to our Stress and Heart Health webinar. Today we are going to be talking about the different aspects of stress, how it affects our health, and some different ways that we can manage our stress for optimal heart health. We have some wonderful speakers joining us today. Dr. Lawrence Levin, our cardiologist, Dr. Julia Kim, clinical psychologist, and Vincent Lupino, physical therapist. To start off, I'm going to pass it over to Dr. Levin.
Hello, good afternoon, everybody. It's a pleasure to talk today about a very important topic. Thank you. Very important topic. We all know the importance of modifying our risk factors for heart disease. We're all probably very aware of the importance of controlling pressure, controlling sugar, controlling cholesterol, and reducing our risk for heart events, cardiovascular problems. But just as important is controlling stress. And we do know that stress is a major factor for heart problems and heart concerns. And so I'm going to review with you in a few minutes some of the effects of stress on the heart. We're going to focus initially on the effect of acute surges of stress on the heart muscle, and then we'll talk about some of the effects of chronic stress on the vasculature of the heart, on artery problems. Next slide, please. Thank you. So we talk about acute surges of stress and stress on the heart. That tends to affect the heart muscle. The heart muscle itself is sensitive to adrenaline, and the setting of those rapid increases of adrenaline, the myocytes, the heart cells, actually deplete very rapidly of their energy stores and they weaken. So in the setting of rapid increases of adrenaline and stress induction, the heart muscle will weaken. And there's a common condition that's called a stress-induced cardiomyopathy. It's known appropriately by a couple of different names. One is the broken heart syndrome. And that actually refers figuratively to the emotions of a broken heart, not just the physical breaking of the heart itself. And in broken heart syndrome refers to the heart's response to the changes in emotional stress on the heart. We see this condition happen after major international events, catastrophes, major traumas, both emotional and physical trauma can bring this out. Another name for the exact same syndrome is Takotsubo cardiomyopathy. So what Takotsubo is that image on the page right now is of a jug. It's an octopus in a jug, and we use that jug is used to catch octopus. The way it works, apparently, I've never used it myself, is as you can see, the jug is very large on the bottom, but the opening, the orifice, is very narrow. And apparently when this is submerged under the water next to an octopus, the octopus will go in with its body, but it can't go backwards without enlarging its body, apparently. And so it gets stuck in there. It can't back out. And so when you pull the jug up out of the water, the octopus will be stuck in there. And so why is that relevant? In people who have this Takotsubo or broken heart syndrome cardiomyopathy, the apex or the tip of the heart tends to be akinetic, dysfunctional. It's not moving, it becomes very enlarged, but the base of the heart by the valves actually functions very normally. So when you see the heart, it actually has a shape very similar to this Takotsubo. And again, these are effects of acute stress on the heart muscle itself, where the heart muscle rapidly weakens. Patients who have this syndrome present typically with chest pain. It can be shortness of breath. There can be palpitations or fainting spells. It can be catastrophic, but 90% of people do have a good recovery for this. So again, this is related to acute stress. Now we're going to talk about some of the effects of chronic stress on the heart. If you wouldn't mind, next slide, please. So there's a lot of strong epidemiologic data associating chronic stress and heart problems. In general, patients who report chronic stress have a 27% increased risk of any vascular event. And by the way, when I refer to a vascular event, what I'm referring to is a blockage in the artery. So that could be, if it's a blockage in the artery of the heart, that's a heart attack. A blockage in the artery to the brain, that would be a stroke. A blockage in the artery to the legs, that would be circulation problems or claudication in the legs, pain in the legs. So stress can induce atherosclerosis in all of these places. And patients who report work-related stress has a 40% increase in the risk of any vascular event. Patients who suffer from anxiety disorder have 3 times the risk of a heart attack. Patients who report anger or hostility, and the highest level of anger and hostility, have 5 times the risk of a heart attack as opposed to patients who don't report anger or hostility. Patients who are depressed, who have a heart attack, are twice as likely to die of that heart attack as opposed to patients who are not depressed. And last and definitely not least, patients who report loneliness or social isolation have a 50% increase of a stroke or heart attack. So again, there's clearly a strong relationship. So why is there that relationship? So first, we're going to talk about some of the behavioral aspects of it, and then we'll talk about some of the biologic aspects. Next slide, please. Thank you. Yeah, so when we're suffering from mood changes or anxiety or stress, our behavior is affected very clearly. People who suffer from stress are more likely to smoke. They're not as likely to eat well. They're less likely to exercise and tend to be less compliant with medications. So there are clearly psychosocial, there are clearly psychological aspects to this, but there are also biological aspects to this. Next slide, please. So when we think about the biological aspects, the major association is hormonal. And this is related to the mind-body concept. It's mediated through the hypothalamus. So the hypothalamus detects stress. The hypothalamus in the brain detects stress, sends a signal over to the pituitary gland, which sends a signal to the adrenal glands to release hormones. And these hormones can have adverse effects on your arteries. There are two fundamental types of hormones that are released by the adrenal glands that can have these adverse effects. One is cortisol, which we're all probably familiar with. If any of you have had injections at special surgery, a cortisone injection is a steroid injection, or maybe a topical cream like a hydrocortisone cream. These are all steroid-based creams, but systemic steroids, as in cortisol, which is released from your adrenal gland, they raise your sugar, they raise your cholesterol, and they raise your blood pressure. So cortisol is part of your fight or flight mechanism. It's part of stress. On the other hand, it has these adverse effects of increasing sugar, cholesterol, and blood pressure, which can affect your arteries. The other type of hormone that we talk about is adrenaline. We call it the catecholamines, the adrenergics that are released from the adrenal glands that can have many adverse effects. One is they make the heart beat harder and faster. That's a favorable thing in the setting of fight or flight response. On the other hand, if the heart's chronically beating harder and faster, that raises your blood pressure. It also makes the heart require more oxygen to function because the heart's working harder. It has its own nutrient and oxygen requirements. So if you have a partial blockage in an artery and the heart's beating harder, its demand for that oxygen, its demand for nutrients goes up, but the supply cannot increase if you have a blockage. The other thing that adrenaline can do is it can bring out arrhythmias. It's strongly associated with atrial fibrillation or ventricular fibrillation. And so anyone suffering from atrial fibrillation would know that that can have its own consequences, and adrenaline is related to that. And last but not least, if you have a stable plaque, a plaque that's not growing inside of your arteries, that's not giving you a problem, the rapid surge of adrenaline can destabilize that plaque and cause it to grow. So again, for hormonal reasons, chronic stress can cause plaque buildup in the heart. Next, please. Lastly, there are other mechanisms are involved also. When we think about plaque, we always think about cholesterol, but understand that plaque or atherosclerosis is actually activation of your inflammatory cells, your immune cells, to take in cholesterol to form plaque. So under a microscope, when we look at plaque from the artery, we'll see not just cholesterol crystals, but we'll see activated immune cells. And so in the setting of stress, your bone marrow is activated, and these inflammatory cells, these immune cells, are activated to start taking up cholesterol. So the actual histologic process of plaque growth is increased by stress. The other variable is your platelets. Platelets are part of plaque. Platelets form the cap on top of plaque that prevents plaque from growing. But under stress, those platelets are activated to start forming clots. So it's a double whammy. During stress, you're more likely to form plaque, and you're also more likely to form clots on top of that plaque that can block arteries. And last and definitely not least are the endothelial cells. Endothelial cells are cells that line the inside of arteries and protect the arteries from damage. So they're the barrier between your arteries and the blood flow inside the arteries. In the setting of stresses, endothelial cells don't function normally. And because of that, your arteries are predisposed to spasm, which is a rapid clamping down of the arteries, thereby restricting blood flow to the heart muscle. And the arteries also stiffen. They lack their compliance, so they can't dilate when they need to increase blood flow when necessary. So in summary, we do know that stress has significant adverse effects on the heart. Acute stress, rapid increases in stress can affect the heart muscle very directly and cause that Takotsubo cardiomyopathy. Chronic stress by multiple mechanisms, both behavioral and histologically, can cause plaque growth or atherosclerosis growth inside the arteries. Thank you very much.
All right, thank you, Dr. Levin. That was really informative. And so now that we have a better understanding of how stress affects the heart, I would like to talk more about how stress and stress and different ways to cope. My hope is that this will inspire you to think about ways you experience and can manage your own stress levels. So everyone has stress, and we experience different kinds of stress, often at the same time. We have physical stressors like an injury or illness. We have mental stressors like negative self-talk or having doubt. We have emotional stressors in life changes or relationships. And we even have external stressors like a pandemic. Now, keep in mind that stress doesn't have to be unwanted or negative. We can actually experience stress over things that we look forward to. For example, getting married, retirement, or even going on vacation. If you're feeling stressed, you're not alone. Before COVID, the prevalence of any mental illness was consistently about 19%, with about 11% of the population endorsing feeling anxious or depressed. The latest survey from December shows about 32% of the population feels anxious or depressed, and actually peaking at almost 43% in 2020. So as a whole, we're really stressed. Since stress is so universal, I provided some common stress symptoms. Sometimes symptoms can be due to different causes. The ones in red are examples of symptoms that can be attributed to stress, but can also be symptoms of cardiac disease. These include, but are not limited to, fatigue, difficulty concentrating, forgetfulness, muscle tension, headaches, shaking, sweating, increased or new pain, and feeling numb. I also want to highlight some common anxiety and panic attack symptoms. The ones in red can also be experienced with cardiac disease, such as a heart attack. So for example, someone could be experiencing chest pains, shortness of breath, dizziness, tingling, and fear that they're having a heart attack. And after going to the hospital, they're told it was actually a panic attack. Now this can be very frightening and confusing. Because symptoms are due to various causes, the more you know about your own stress levels, your response to stress, and your overall health, the more it can help you and your doctors assess what is happening and take control. I also want to emphasize, if you do have physical symptoms, it is important to have a doctor check you out. You don't want to assume it's just anxiety. So we all experience varying degrees of stress, and sometimes it can be so overwhelming you feel you can't get out from underneath it. The goal is to find balance. So balance is achieved one step at a time. When you feel overwhelmed, the goal is to work on one item at a time. Essentially, instead of one overwhelming mountain of stress, you identify the stressors and place them into separate, more manageable piles, and then work on them one at a time. This makes it more manageable. It allows us to feel more in control and to achieve success. It also helps you to identify how you feel about the separate issues, because they're not all the same. When we group everything together as one overwhelming experience, everything feels too much. But when you see each area by itself, it's less daunting. Another aspect of balance is recognizing what is good in your life. Now, everyone has something good, even if it's that it's sunny outside today, or just that you want to feel better. This gives us a reason to tackle the stressors. And each stressor you work on, that you work through, actually becomes something good to help you feel more balanced. Focusing on what you can control can help gain balance. For example, we have control over our thoughts, and our thoughts guide our feelings and behaviors. The goal is to control your thoughts in helpful ways. So for example, Let's say you go to the doctor and the doctor says you have high blood pressure and wants you to eat a heart-healthy diet. And your initial response is, oh, I have to deprive myself. I'll never be able to enjoy food, and I just can't do that. Now, this doesn't help you to resolve the problem and can make you more anxious. So let's say you change your thought to, this is an opportunity to find heart-healthy foods that I enjoy, so I can be healthy and continue to love what I eat. This thought opens the door to resolving the problem and feeling less stressed. Another way to manage stress and achieve balance is through self-care. When we're stressed, all your energy is essentially being drawn away from you, and self-care brings energy to you. And one way you can do this is through sleep. Sleep restores our body and mind so we can function at our best. Without adequate sleep, our resources are drained, making everything more difficult to do. In other words, we're more stressed. Oversleeping is not good for you either, and it can cause health problems such as diabetes, heart disease, obesity, and depression. Adults typically need between 7 and 9 hours of sleep, so pay attention to how you feel when you wake up. The goal is to feel rested and refreshed. Another way to restore yourself is through breathing slowly. Now, if you already have a breathing exercise that works for you, that's wonderful. Keep it up. If you've never tried it, I recommend you keep it simple. Focus on breathing slowly and comfortably, which I encourage all of you to do now as I speak. If you can inhale through the nose and exhale through the mouth, please do. If not, that's okay. Do whatever is comfortable for you. Slow breathing stimulates the vagus nerve, which is part of our parasympathetic nervous system that regulates the body in a relaxed mode, as opposed to the fight or flight mode. Think of breathing as inhaling and inviting in a sense of calm, and slowly exhaling, removing the stress and tension. When you slowly exhale, the vagus nerve triggers a slowing down response, resetting the body. The reset helps us to feel calmer, it slows our heart rate, and provides immediate benefits. Now remember, the reset occurs on the exhale. If you're having trouble breathing comfortably, start with a sigh like this. Essentially, a sigh is an exaggerated exhale, and people sigh without thinking about it when we're overwhelmed as a way to relieve pressure. So practice sighing and then transition to breathing slowly and comfortably. So those are a few tips to managing stress and achieving balance. I've included a few more slides for you to review on your own. I hope all of this encourages you to be mindful and manage your stress levels for a healthy heart and overall sense of well-being. Thank you, everyone. I will now turn you over to Vincent.
Thank you, Dr. Kim. That was a great talk and good actionable steps on managing your stress. I'm going to talk today about exercise for heart health. All right, so benefits of exercise for your health. So as we know, exercise can help lower your risk of developing new chronic health problems such as diabetes, high blood pressure, or heart disease. Exercise has been shown to keep your brain healthy, reducing your risk of developing Alzheimer's and dementia. And exercise can help reduce your risk of falling or having a fall-related injury, as well as keeping you independent. Now, with respects to stress, exercise has great benefits as well. Exercise can help boost your mood, sharpen your focus, improve your sleep, and reduce your stress overall. So these are great individual benefits, but when you put them all together, it helps promote well-being. So my main focus for today is talking about exercise guidelines. So I use the American Health Association for these guidelines. And what is recommended is adults receive at least 150 minutes per week of moderate intensity aerobic activity. This also can be substituted for 75 minutes of vigorous intensity for aerobics. So these are, again, can be interchanged. Along with the aerobic activity, it's also recommended adults have 2 days worth of muscle strengthening activities. So I'm going to go into now the next couple slides to help define these. Aerobic activity, what is aerobic activity? This is any movement that helps get your heart rate up. These are divided between moderate and vigorous. So for example, moderate intensity aerobics would be brisk walking, water aerobics, dancing, gardening, playing doubles tennis, or biking slower than 10 miles per hour. Vigorous would be walking uphill, running, swimming laps, heavier yard work, playing single tennis, or cycling 10 miles per hour or faster. So from my perspective is the body doesn't know what type of movement you're doing, it just knows that you're moving. So anything that gets your heart rate up counts as aerobic activity. With the recommendations from the American Heart Association, we want to try to do 3 to 5 days per week with rest days in between these two different categories. Now, strength training. Strength training is any type of exercise that helps improve your muscle strength. So this can be body weight exercises, exercises using different weights such as kettlebells and dumbbells, using exercise machines, as well as resistance bands. It's recommended to do this 2 times per week with a rest day in between to allow for muscle recovery. For your specific types of exercises, you would want to do 1 to 3 sets for 10 to 15 repetitions per exercise, trying to work on different muscle groups for your upper and lower body. So there's a lot of different recommendations of terms of these types of activities, but I wanted to put these into examples to try to paint the picture of what this would be for someone to meet the guidelines. So for example, 1, this is someone that does moderate aerobic activity 5 days a week. So this can be someone that goes for a brisk walk or maybe some light swimming. So they're receiving that 150 minutes, and they're also doing their 2 days of muscle strengthening activities. Example 2 is someone that maybe likes the vigorous aerobic activities such as running, jogging, maybe playing singles tennis. So they're doing this about 75 minutes per week with their 2 days of strengthening activities as well. Example 3, I think that's the more practical approach. So it's kind of a combination. It doesn't need to be one or the other scenario. So you can have someone that's maybe running, for 30, 45 minutes per week, but then also goes walking for 30 minutes 3 times per day, and they're doing their strengthening as well. So it's all about trying to figure out what would make sense for you in your day-to-day, what you like, and how that works in terms of your schedule. So this is very important. So the way to actually track aerobic activity. So the way I look at it is if you're going to spend the time and you want to exercise, you want to make sure you are meeting these recommendations. So moderate exercise would be 50 to 75% of your maximum heart rate. Something to be considered vigorous would be 70 to 85% of your maximum heart rate. So in order to calculate maximum heart rate, you take 220 and minus your age. So for an example, I'll use a 60-year-old adult. That 50 to 70% range of their maximum heart rate would be 80 to 120 beats per minute. 70 to 85% for vigorous exercise, that would fall between 112 to 136 beats per minute. So for me, it's all about practicality. How are you actually tracking this? So I have a couple examples on the bottom of the slide. So a lot of our smart watches, Apple Watches, Fitbits, all have heart rate capabilities. And if you enter exercise mode in most of these watches, it'll let you know exactly the percent you are falling while you're exercising. Other options is a heart rate monitor, which can connect to either your phone or watch. Some exercises, cardio equipment like the elliptical, rower, bicycle, they have heart rate detectors on them as well, which can let you know your exact heart rate. Or you can do the old-fashioned way, checking it manually yourself. So what this would be is you take your index and middle finger, you're going to place it on your pinky side of your wrist, and you're going to feel your pulse. So you need to count. The best way to do this would be counting how many times you're feeling the pulse in your fingers. You would want to do this for 30 seconds. Whatever that number is, you would multiply it by 2. So if we go back to our example of a 60-year-old adult, let's say they want to fall into 50 to 75% of their max heart rate. So that would be moderate exercise. So let's say they're aiming for 100 beats per minute. They would feel their pulse. Within a 30-second time frame, if they achieve 50 beats, you would times that by 2, and that would give you your 100 beats per minute, satisfying this category. Other low-tech ways to track your aerobic exercise, you can use the talk test. So moderate activity would be, using the talk test would be that you're exercising, you're breathing a little bit harder, but you're still able to have a conversation. So an example might be a brisk walk with friends and you're having a conversation throughout the entire time. Vigorous activities would be that you're exercising, you're only able to say a few words before having to take a breath. So you can think of maybe a sprinter or hiking up hills where you feel like you need to catch your breath. So that would match that level of activity. And another way as well is you can use the perceived effort scale. So this is a scale ranging from 0 to 10. 0 means you're resting. 10 would be doing something at maximum effort. Moderate intensity would be on a scale of 3 to 4, and vigorous would be 5 to 7. So it's not within the scope to go through these specific exercises, as everyone has an individualized program and capacity, but I wanted just to throw a couple examples of some fundamental movements that you do throughout your day. So these are examples of strengthening exercises. Remember, the recommendation is 2 days per week. So on the left-hand side, we have someone performing a sit to stand, which is a squatting pattern to an eventual full squat with some resistance. And then on the bottom, you have someone doing a wall push-up, eventually progressing to a full push-up on the ground. So for what constitutes as strengthening exercises is all different types of modalities that you can use to achieve this. So you want to stress the muscles to help build strength. So this can be done with elastic banding or tubing. So the person on the top corner is doing a hip exercise where the person on the right is doing a row using the tubing. You can also use different types of weights such as dumbbells or kettlebells to perform shoulder pressing, squatting, deadliftings, anything that you want to try to challenge the body to improve the strength. So the main question I usually get as a physical therapist is where do I start? So for me, I always recommend someone to see their primary care, their cardiologist, make sure that they don't have any conditions that might impede their ability to exercise. And once you have that clearance, there's all different avenues that you can go. You know, you can start something by yourself, maybe being a walking program, swimming program, something like along those sorts. Or you may go to a personal trainer to show you how to use some different resistance for the strength training. And they can also incorporate aerobic and strengthening exercises. If you're dealing with any injuries, you can go see a physical therapist like myself to help address that injury and get you moving. And then you also have an option of seeing an exercise physiologist, which they're able to use different tools to measure your fitness level and make recommendations according to that. So my advice on getting started with any exercise program, keep it simple, work your way up, make a plan, stick to it, and the main thing is consistency. So just want to remind you again, those recommendations from the American Heart Association is 150 minutes per week of moderate aerobic activity and 2 strength training days, or that 75 minutes of more vigorous work. Do things that you enjoy. So if you're not a runner, don't start a running program. Maybe you like swimming, tennis, hiking, anything like that. You're more likely to stick with your exercise program with doing something that you enjoy. And I always recommend being active with a family member or friend. So you get some of the benefits of accountability, which is important, but also just having that companionship will lead you to keeping up with those exercises and your program overall. So thank you.